Can the orthodontist proceed with an orthodontic treatment when a tooth has periapical radiolucency? I'm Dani Mancusi, specialist endodontist and prosthodontist, and in this episode of the Diary of an Endodontist, I'm going to discuss that with you. Stay with me. The orthodontist noticed the periapical radiolucency during the orthodontic treatment and straight away referred the case to us. As you can see in the x-ray of this upper right first molar, the radiolucency is there and the patient has now started to develop some symptoms in the tooth. Now is the time to stop the orthodontic treatment and deal with that issue, which was possibly already with the inflammation over there or the chronic infection, but non-detectable in the x-ray when the dentist assessed the case. The root canal treatment was then carried out. As you can see, there are 4 canals, and pay attention on the straight line access in curved roots so you don't ledge those canals. Patency was established. You can see the sealer puffs and you can see the root filling going to the apex. Make sure everything is disinfected thoroughly and obturated to the highest standard possible, because this tooth needs everything to be able to function again and to be able to be part of the orthodontic treatment successfully. The orthodontist always asks when he can proceed with the forces, and I normally say that light forces can be proceeded in the other teeth in 4-6 weeks. However, in this tooth in particular, it has to be either the lightest possible or no forces at all until we confirm the healing. So 3 months is the advised time for me to take an x-ray, for example, and see if there is healing happening in this tooth. If you take a scan, you can take slightly in earlier than that, but if you are relying on the x-ray, 3 months is a good amount of time for you to see slightly bone formation in this area to really assess whether the radiolucency is reducing in size or not. Comparing this x-ray, that is a 3-month review x-ray, to the post-op x-ray, you can see that the lamina dura is now very close to the root in the mesial root and also is starting to form in the palatal root. So when you see that formation of the lamina dura, the white line around of the root, you are a bit more convinced that the healing is now being successful, at least is starting to be successful. And of course, the symptoms of the patient as well, the tooth is completely asymptomatic. When that happens is the time that you can allow again light forces in the beginning for that tooth. This case emphasizes why it's so important to do a proper clinical and radiographic examination. If you detect that prior to orthodontic treatment, it's a lot easier to deal with that and it doesn't disturb your treatment. So make sure you do that properly, and good luck with your cases.